Hi, I'm Dr. Karen Horridge and I'm a paediatrician, which means a children's doctor. So what does a paediatrician have to offer for children and young people with a learning disability? Well, the paediatrician might be somebody who actually identifies that the learning disability is there by gathering information from colleagues in education and across settings. The paediatrician might be thinking about any associated health conditions that need to be identified and managed. So those might be genetic or chromosomal conditions that might run in a family. And that's really important to know about so that we can give all the right information to the person and their family about their condition and what to expect for the future. The paediatrician might manage difficult symptoms. They might, for example, identify and manage epilepsy, which means having seizures. They might recognise and manage reflux, where acid comes back up the food pipe from the tummy, which can be sore. And they spend a lot of time managing constipation and difficult poos. And there's a separate little video about that. The paediatrician also thinks about the person's posture and movements along with the physiotherapist to make sure that the person can move around and be free of pain. The paediatrician also links up with lots of other experts in super specialist areas, so experts in children's hormones, experts in growth, experts in kidneys, experts in hearts, expert neurologists as well, and clinical geneticists. There's lots of advances in the field of genetics going on, and so we can give a lot more information now about associated health conditions. The paediatrician works very closely with and supports the general practice team. It's really important that learning disability is given its name so that the young person, when they get to 14, can start accessing their annual learning disability health checks with the GP. And then when the young person gets somewhere between 16 and 19, the paediatrician will be talking with the young person and their family about handing on the baton for ongoing secondary healthcare if it's needed to the right expert to continue on through adult life. So that's a little bit about what a paediatrician does, and if a paediatrician doesn't know the answer to a question, they have lots of phone a friends that they can go to and network with to make sure that all health needs are correctly identified and addressed. Thank you for listening.